My name is Kat White with UK College of Nursing for class Nursing 211, section 003. I'm going to do my Foley catheter competency today. I have scenario number 78. Our patient is Mrs. Ren Harumi. Her date of birth is 03/03/83. Her patient ID number is 160011180. She's going to begin an intensive diuretic therapy, so we need strict INO monitoring, which will require an indwelling Foley catheter with a dependent drainage system. So I'm going to perform hand hygiene, and I'm going to collect my supplies. I have some things for perianal care here. I also have a hydrogel coated latex Foley tray. It has a 14 French gauge with a 5 ml catheter pre-connected to a 2,000 ml drainage bag. I also have a pair of sterile gloves here. Both of these packages are intact and their products are not expired. So now I'm going to go to the patient's room, wait to be invited in. Hello, Ms. Harumi. How are you doing today? My name is Kat White. I'll be your student nurse this afternoon. I'm going to do your Foley catheter, if that sounds okay with you. Patient confirms her consent. I'm going to provide for privacy and perform hand hygiene again. So next I need to check the patient's wristband. We're going to look at name and date of birth. Ms. Harumi, can you tell me your full name and date of birth? Patient states Ren Harumi, 03/03/83. Ren Harumi, 03/03/83. And then I'm going to check the ID number as well. So for ID number, I see 160-160-01-0180. So all the information is matching. I also have to do an assessment for a level of consciousness. So Ms. Harumi, can you tell me your full name one more time? Patient states Ren Harumi. Can you tell me what day of the week it is? Patient says Sunday. Can you tell me where we are right now? Patient says UK College of Nursing. So all of these are correct, which means that the patient is oriented ×3, and that means we're safe to proceed. So now I'm going to adjust the bed height to a working level, and I'm going to lower the sidewall nearest to me. I'm going to ask, Ms. Harumi, do you have any allergies to betadine or latex? Patient states they have no allergies to betadine or latex. So next I'm going to assess the abdomen and bladder. So in order to do this, I'm going to perform hand hygiene again. We're going to expose the abdomen, maintaining privacy, and I'm going to inspect for scaffolding, distension, symmetry, and then we're going to auscultate, starting in the lower right quadrant and proceeding clockwise. Then we will percuss, and then we will palpate. We will also palpate the bladder and obtain a bladder scan if necessary. So with the assessment there complete, I'm going to begin perianal care. So I'll ask the patient to position their legs comfortably, and providing for privacy, wash my hands again. And I'm going to don non-sterile gloves, and then we're going to get our perianal supplies here. I've got warm water here, my towel and my soap. I'm going to put some soap on the towel, some water. I'm going to separate the labia. We're going to clean from the top to the bottom on the side of the labia farthest from me. Switch to a new side of the towel, clean from the top to the bottom on the side of the labia closest to me. And then we're going to clean from the top to the bottom, switching side of the towel, down the center of the urethra. And then we're going to rinse with fresh warm water, following the same steps. Top to the bottom, side of the labia farthest from me. Top to the bottom, side of the labia closest. And top to the bottom, down the center of the urethra. I'm going to remove my gloves and perform hand hygiene. So now we're going to prepare the Foley catheter tray. place it on the bed between the patient's legs. So now I'm going to take the sterile drape. We're going to look for a good corner to pick it up from. We want the shiny side facing towards me, and we're going to drape it between the patient's legs. Now I'm going to don sterile gloves. So I'm keeping the sterile field within my line of sight. So I have my package of sterile gloves here. I'm going to open, grab out the package, open it with a hook, open from the top first. We're keeping everything in this sterile area for these gloves here above the waist level. So I'm going to don my dominant hand first. So use my non-dominant hand to pick up the dominant hand glove. I would step away from the table to don the glove. And now I'm going to scoop, using my dominant hand to pick up the glove with the non-dominant hand, step away from the table. Okay, and we have donned our sterile gloves. We can move back to the bedside. There are a couple of items in this kit that I do not need to use, that I can dispose of. We're going to remove the tray and set it closer to our workspace here. I'm starting by preparing the catheter here. So for that we have our lubricant. We're going to take the end of the catheter that we'll be inserting and applying the lubricant to it. We're going to leave it in the tray. We're also going to go ahead and hook up the sterile water syringe to the port. And we can leave it in the tray. I will pour the betadine over the cotton balls here. And now it's time to use my non-dominant hand to separate the labia. And now this hand will be contaminated and we cannot bring it back into the sterile field. So with the labia separated, I'm going to use the betadine and the cotton balls to perform perianal care again. Following the same procedure where we clean from the top to the bottom, the farthest side of the labia first. From the top to the bottom, the closest side of the labia. And down the center of the urethra. Okay, so now we can insert the catheter. So I'm going to remove it from the lubricant package. We're holding the catheter directly below the balloon. Ms. Hirumi, will you take deep breaths for me while we do this? This will make it more comfortable for the patient. And we're going to insert. We want to insert 3 to 4 inches. But most importantly, we want to continue inserting until we see urine. So now that we've seen urine, we're actually going to go ahead and insert about 2 more inches. Then we'll use the non-dominant hand to stabilize the catheter, because we have to inject the sterile water to anchor the catheter. I'm going to dispose of this tray here. So the catheter is anchored now. It can release. I'm going to remove my sterile gloves. Dispose of them. I'm going to wash my hands again. And I'm going to don non-sterile gloves because I need to do perianal care one more time. I'll just be verbalizing this one. We would clean in the same procedure, farther side of the labia and the closer side of the labia, and then the center, and we would clean down the catheter a few inches as well. We especially want to do this because it's going to remove irritating agents like the betadine or the lubricant if they were left on. Okay, so now we want to remove my gloves and wash my hands again. And then we will be taping the catheter to the patient's leg. We want to make sure it's nice and secure so it doesn't get tugged. So I'm going to loop it up here, tape it to the patient's leg. I'm going to go ahead and dispose of all the rest of this because it's time to attach the catheter. Okay, the drainage bed. We want to attach the drainage bed to a part of the bed that is not moving because we don't want it to be tugged on. We want to make sure the bag is hanging below the level of the patient's bladder to prevent urine from flowing back in. So, Ms. Rumi, is there anything else you need from me today? We're providing patient's privacy again, making sure she doesn't need anything else from us. And we're going to leave her with the call light very accessible, and we're going to perform hand hygiene again, and we'll leave the room because I have to do some documentation. So we have left the patient's room, and I'm going to document. So we had a 14 French Foley catheter. We inserted at 1700 by Cat White on initialing. Patient didn't report any pain or discomfort during the insertion process. We did get some urine output during the insertion. It was slightly cloudy. Patient reported that they did not have any allergies to betadine or latex. Okay. So we have the date, the time, my initials, and a few notes on how the procedure went. Okay, so this will conclude my competency for Foley catheter. Again, this was scenario 78. Thank you.